So the vaccines were, the Gardasil was originally licensed in the United States in 2006, as well as in countries like Australia. So for countries that started to vaccinate in 2006, 2007, we now have years of data where the vaccine has been distributed in populations, which gives us the opportunity to ask the question, okay, how well do these vaccines perform in the real world setting? And this is where it gets so exciting. Australia took on the cause of HPV vaccination, and within a couple of years had vaccinated over 80% of all their age-eligible females in the country with the full 3-dose series. Within a couple of years, they have shown a dramatic, as in a near disappearance of genital warts in the population of young females. So this is showing you, this is the first hint. Now, we talk about genital warts because this is a lesion that occurs in young individuals and occurs relatively quickly after first infection. So it's one of the first signs that we will have of whether the vaccine is working. But now, for those of us who care about cancer, what is the evidence that it is preventing cancer? Well, the other good news, a couple of years after that, Australia and now other countries around the world, like Denmark, and even in the United States, even with our low rate of penetrance and dissemination of HPV vaccine, we are now seeing documented decreases, as in very significant, large decreases in the incidence of high-grade cervical dysplasia, the obligate precursor to cervical cancer. Remember, that's the basis of our screening program. If you detect and treat those lesions, the woman doesn't develop cervical cancer. But we now have evidence that in populations that are vaccinated, that the vaccine is reducing the occurrence of those obligate high-grade cervical lesions. So it's really a wonderful story. Now, to actually see the full cancer incidence decrease will likely take us decades. So I expect in the coming 2 decades or so that we will see a dramatic shift in the incidence of these cancers reported through our national registry systems. The clinical trial data that we have to date can tell us this. If we look at Gardasil and we look at Gardasil 9, there have been numerous female vaccine trials conducted internationally. We have clear evidence from the clinical trials that both those vaccines will prevent the infection and high-grade lesions that these HPV types cause at the cervix, the vulva, and the vagina. In men, there was one clinical trial that was conducted, international randomized controlled clinical trial of Gardasil, that has clearly shown the reduction of external genital HPV infections, it's mainly penile infection, and the lesions, which in young men, which is the population the trial was conducted in, is genital warts for the most part, as well as the reduction of anal canal HPV and the prevention of those high-grade anal lesions that can progress to anal cancer. So the indication, what do we have licensure for? We know that the vaccines will prevent cervical, vulvar, vaginal, and anal cancers. An anal cancer indication is both for men and for women. And we know that these 2 vaccines will prevent genital warts in both men and women. But what about oropharyngeal cancer? This is the cancer I just finished saying is increasing in the United States as well as worldwide, with a higher and higher proportion due to HPV. Well, unfortunately, there has never been a phase 3 trial to definitively assess whether the vaccine will prevent oral HPV infections or the lesions that those infections cause. We do have some hints that there may be a benefit, but these are secondary analyses of trials conducted among women. And if you recall, it's men where we really have the problem. They have the higher incidence, 3 to 4-fold higher, and the growing incidence. I think we're all hopeful that the vaccine will prevent HPV-related oropharyngeal cancer. But without definitive evidence, we cannot make that statement, and it has limited our ability to make recommendations through different organizations like the dental organization. So this remains a research question that is a very important research question. The HPV vaccines are highly efficacious and now we're showing effective in reducing infection and disease. And what is even the better news is these are very safe, well-tolerated vaccines. The most common complaint following vaccination is literally, ouch, it hurts. And of course, this is a sign of a vaccine that is very good at recruiting immune cells to the site of injection, which tells all of us that it's highly immunogenic and is very strong in protecting against the viruses that we care about protecting. In the United States, there is consistent prospective evaluation of safety by the FDA and the US CDC. That same level of scrutiny around safety of the HPV vaccine is taking place in Europe by the European Medicines Agency, EMA, and all of those data are shared with the World Health Organization, who also evaluates the safety profile of the vaccine following worldwide distribution of the vaccine. And in total, all the agencies are making a very strong statement for continued HPV vaccination, given its strong record of efficacy and effectiveness and its high level of tolerability and very safe profile.